The Honourable Member from Charlottetown-Belvedere.
Thank you, Mr. Speaker. With the advent of Omicron, we've witnessed a decided shift in this government's approach to the pandemic. Government is moving away from public health, preventing illness within the population, and is shifting to personal responsibility. Our plan to move on isn't reflected in our COVID numbers, though. What interventions, if any, will we see from government as the numbers continue to rise? Going back to normal should mean less illness, not more. Government is asking islanders to assess their own risk, but this requires government to provide adequate information to inform their decisions. Government does not make this easy. Ever since this transition to personal responsibility, we have been provided less and less information to the public. This does not provide comfort to those who are really worried. So many islanders are scared, and rightfully so. They have assessed their own risk to the extent that it's possible, only to see government downplaying and ignoring their risks and concerns. We have a crisis of compassion, Mr. Speaker. Islanders who are now and have always been at greater risk because of their vulnerabilities are feeling utterly invisible and abandoned. Instead of getting inclusive public health policy that respects the risk to vulnerable people, we're being told to be less fearful. We're told Omicron is less dangerous, even though it has hospitalized and killed more people on PEI than any other variant. It's probably no surprise that vaccination rates for our youngest have underperformed expectations, as government assures island parents that COVID is mild. Our most vulnerable islanders are not worth less because they have a condition or circumstances that make them vulnerable, and they are right to be afraid when their very life and well-being is at risk. Here's who I'm hearing from, Mr. Speaker. Parents of children under 5 who aren't able to be vaccinated yet. Mothers whose children have complex and life-threatening illnesses, which mean their entire family is isolated to protect that child because they can't go out and about in public when they don't know where is safe. Patients in cancer treatment, young adults with cystic fibrosis, seniors with COPD, and the adult children of seniors like me, Mr. Speaker, who are worried sick about their loved ones, feeling that everything they do to protect them isn't enough. Had we tried to create new normals and new societal expectations rather than insisting on getting back to a normal that wasn't serving everyone as it was, we would have all been better for it, Mr. Speaker. If only compassion was as contagious as COVID.